Hi, I'm Dr. Julie Steinauer, and today I wanted to talk to you about kind of a serious topic. If you haven't heard about this or seen the association with this in any kind of news-related articles or information, I wanted to share today. There are some studies that have been done on concussions in our high school students and the risk that it poses for suicide. So there's a test or a survey that was completed, the Youth Risk Behavior Surveillance Survey done in 2017 had 13,000 high school students between the ages of, or grade levels of 9 and 12. And of those participants, 60% of them say that they were more likely to have attempted suicide as a result of having a concussion within a 12-month period of that survey. 20% were more likely to be depressed, and 25% were more likely to have thought about suicide. Some other stats are that male students were typically twice as likely to have attempted suicide and 3 times as likely to have received medical care treatment as associated with an attempt on suicide. What are some symptoms of concussions? Well, common symptoms are loss of consciousness, obviously, but we also have headache, confusion, memory issues, and then changes in mood. But there are visual symptoms that you should be aware of as well. So double vision, blurry eyesight, sight that kind of tends to like move and wobble around and not stay stationary, and light sensitivity are very common post-concussion. And particularly for double vision and that wobbly type of vision, it's very difficult for the student or individual who's had the concussion, and it can leave them feeling pretty anxious, upset, and depressed. Here are some things that the National Suicide Prevention Lifeline mentions warning. Looking out for things like a feeling of hopelessness, withdrawing, social isolation, extreme mood swings, or reckless, anxious behavior. So, if your child, if your athletic student in your household has had a concussion, you need to be aware of these warning signs. You certainly need to be aware of the symptoms they might be experiencing. And if they're experiencing visual symptoms, sometimes they happen right after concussion, or sometimes it takes a little bit of time before they develop. And they can linger a long time, but there's treatment for that. We use something called photosynthetic light therapy, where we train the brain to be able to process information differently. It's kind of electrically resetting the brain after concussion to process vision better. So we can decrease or get rid of altogether those symptoms that they have associated with having had the concussion. For more information about what we do to treat concussions or traumatic brain injury in general, you can go to our website at visionforlifeworks.com. And if you know someone or you yourself have had a concussion, then contact our clinic at 618-288-1489, and let's discuss how we can help you or your child improve the symptoms that they're having associated with concussion. Thank you.